Welcome to the Fear and Greed Daily Interview. I'm Sean Aylmer. For the last 18 months, health has been in the spotlight like never before. Governments around the world have poured billions of dollars into the sector in the face of COVID-19. And at the same time, the way we engage with health professionals is evolving through changing technology and the adoption of telehealth. I wanted to have a closer look at investing in the health sector. Australian Unity is a 180-year-old member-owned wellbeing company, offering everything from health insurance to wealth management and banking services, including home loans, managed funds and bonds. Dr Joe Fernandes is the Chief Investment Officer at Australian Unity. Dr Fernandes, welcome to Fear and Greed.
Thank you, Sean. It's a pleasure to be here.
So is now the time to be investing in health, given everything that's gone on, or have we missed the boat?
Well, Sean, the healthcare investment opportunity is driven by demographics. That is, we're all getting older, unfortunately. And in fact, the most recent census data shows that 1 in 6 of us is now aged over 65. And that number is increasing. So the demographic bulge is moving upwards in age. And regrettably, half of us are living with at least one chronic condition, which can affect the quality of our lives as well as, the lives of our families and carers. So, with these as thematic drivers, the demand for clinical services and healthcare infrastructure really is only set to increase in the future. The long-term investment opportunity and, in fact, the social imperative to invest is there, particularly when you consider the need for ongoing innovation in the sector.
Okay, so I might just break that down a bit. When we're investing in health, you've mentioned innovation and you mentioned infrastructure effectively, services. What are we talking about? If I say, okay, I'm going to invest in health because the demographics are going that way, what is it that I should be looking at?
Well, perhaps can I use a case study of a recently launched Australian Unity Fund, the Australian Unity Future of Healthcare Fund, as an example.
Perfect.
Well, that's something that we're particularly proud of because the fund's the first of its kind in Australia, actually. So the fund is itself an innovation as well as investing in healthcare innovation, if you see what I mean.
Yep.
The fund serves both a financial and a social purpose. It aims to deliver growth by investing strategically to enhance the long-term health and well-being of Australians. And it does that across a range of asset classes, including venture, capital and private equity, domestic and international listed equities, and social infrastructure such as medical and health-related real estate. Within those sectors, the fund provides investment capital to critical areas of development, such as, preventative and remedial healthcare, health IT, technology, devices, pharmaceutical advancements, and the like. Importantly also, the fund leverages the broad experience and expertise within the Australian Unity organisation as a wellbeing organisation. We've recently completed a capital raise for the fund, raising $45 million in seeding and early stage investment. And we're currently deploying that into both listed and unlisted companies at the front line of healthcare innovation.
So does that mean you could be investing in anything from a pharmaceutical company to a hearing implant company to building a hospital?
Well, that's right. So a fund invests across a range of asset classes, which means that it can address the spectrum of opportunity in healthcare investment. The critical component, as I mentioned, is that it's about investing strategically to enhance the long-term health and well-being of Australians. So it's that long-term well-being requirement which needs strategic investment today in that spectrum of areas that make up that healthcare theme, Sean.
Okay. And you mentioned that it was partly socially responsible investing as well, which certainly is getting a lot more support in recent times, sort of under the banner of ESG. But this is a good example of that, is it?
Well, yes, is the short answer. The fund was developed with an explicit responsible investment framework. But if I can, Sean, let me just set the scene a little. My personal belief is that those of us who have the privilege to serve in financial services, _serve, we need to recognise our role in both generating sustainable return streams and as allocators of capital to productive purpose. Right? Our industry talks a lot about the former, that is the investment returns that are generated, not so much about the latter, that is our ability and in fact the imperative to mobilise capital. Right? So responsible investment, which you're touching on, is about taking responsibility for those elements and in fact integrating them together, recognising that this is a journey. We're on a journey, not a destination. Now, as it relates to Australian Unity Wealth, we exist to serve the financial wellbeing needs of Australians as well as the social capital and infrastructure needs of our community. So an integral part of that is to ensure that we are allocating capital thoughtfully in the areas that achieve the aim. And social responsibility is embedded in that. It's embedded in everything we do. In fact, we have a strong community and social value framework that operates right across the organisation. And for my part, I think that provides us with a natural platform for Australian Unity to be a leader in responsible investment.
Yeah.
You asked specifically about the future of healthcare, the implications for the future of healthcare fund. And as I said, the fund serves both financial and social objectives, and its focus on social responsibility has resonated deeply with early stage investors. I should also say, Sean, there are other areas where I feel we are leaders in responsible investment, such as our capabilities in sustainable fixed income and green bond management. Perhaps we can save those for a future discussion.
A few future discussions, that they're huge areas. I just wanted to keep with health just for a moment. The government spends a lot of money in the health sector, and mostly through different state governments. Is investing from the private sector, and Australian Unity being part of that for today's discussion, will increasingly the money for health come from the private sector, or is it something that government will always just have to put a lot of money into?
I think the answer, Sean, to your question is that there is a role for both parts, that is for government and for private investment into healthcare. Right? I can't help but think that the future of healthcare will involve ongoing innovation and convergence with technology, Sean. You mentioned the investment by government in healthcare, and obviously the COVID crisis comes to mind. Well, nothing drives innovation like a crisis, as we know, right? So during the crisis, during the pandemic, we've seen, for example, the successful development of COVID-19 vaccines around the world in record time, right? So have a think about that for a moment. Done in partnership, public and private partnership, the development of those COVID-19 vaccines, normally a decade-long process condensed into months.
Yeah.
What we should be particularly excited about is the future of mRNA vaccine technology, right? That's a technology that didn't exist only a short time ago. So, coming out of the pandemic, the thing that's important to note, I think, is that the world has never been more open to innovation as a driver of efficiency and effectiveness in healthcare, and private investors can see the opportunity.
Stay with me, Joe. We'll be back in a minute. My guest this morning is Dr Joe Fernandes, Chief Investment Officer at Australian Unity Wealth. Telehealth, I'd just like to mention that because that gets lots of talk about telehealth. Is that an area where a fund, or me who investing into a fund, could actually get exposure to if we believe in that?
Well, it's interesting. So you're raising telehealth, which touches on technology. And as I mentioned, I think the future will be sort of ongoing convergence with technology, or between health and technology. And telehealth is one example. There are other examples. Now, it's important when we talk about technology, it's important to consider that technology is only useful insofar as its impact on actual people, right?
Yep.
And therefore, any form of investment in health and aging has to start with people. That's the key driver of how we make investment decisions, right? So is there a clear path to market for each innovation, and will it productively address a long-term need, such as we've seen with telehealth? I'll give you another example, Sean, if you're interested. And this is a company which is in the Future of Healthcare Fund, Lumos Diagnostics. It's an Australian-based company with operations out of the US, and its product has real global application. So a great example of innovation in Australia going to the world, right? And as I mentioned, Australian Unity is an investor. We were an investor in the recent pre-IPO funding round. Lumos has manufactured a diagnostic tool called Fabridex. That's a finger prick blood test which lets doctors know within 10 minutes if a patient that's presenting with a sickness has a viral or a bacterial infection. Now, think about that in terms of rapid triage, and think about that in terms of a massive global issue around overprescription of antibiotics.
Yeah.
This is a real extraordinary example of technology meeting diagnosis in a way that, or diagnostics rather, in a way that has the potential for real impact, including in more targeted treatment of disease.
So does Australia do well at health? We hear about the CSLs and the Cochlears and Fisher and Paykel. That's probably the New Zealanders will probably take that one. Then we've got, of course, all the hospital operators, the innovative firms that you're talking about. Are we good at health?
Well, I think we are good at health, but I think this question relates to your prior question. We need to ensure that we're continuing to invest strategically in innovation that supports the long-term well-being of Australians. So I would say, yes, we've done very well, but the imperative is there for us to continue to do very well, and that requires thoughtful investment.
Yep. Now, Joe, you're a chief investment officer, so I can't sort of let you go without asking generally about markets. What's your take at the moment in terms of equities and fixed income and even cryptos?
Yeah, well, I guess in terms of investment market performance, a number of us, Sean, have been surprised by the resilience of the Australian economy over recent times. Perhaps we needn't have been surprised. What's clear is that Australian and global equity markets have performed particularly well, buoyed in a large part by the ultra-low interest rate environment around the world. Right? Now, Sean, I don't have a crystal ball telling us what's going to happen for the rest of this year and even beyond, but we do know a few things. For one thing, there are significant risks in the system, right? in markets and in the financial system, and they need to be navigated, not just our pathway out of the pandemic, but also questions like, what's the long-term impact of central bank intervention in markets, and what's going to be the impact of the unwinding of that intervention, timing presently unknown. Also, if you sort of zoom out a bit, we've been the beneficiaries of a decades-long process of increasing globalisation and of a persistent bull market for bonds. Now, those tailwinds are petering out, if not gone altogether. Now, that's a pessimistic view, but I do believe, I am an optimist, and I do believe there is room for optimism. We don't know precisely what the post-COVID world's going to look like, but we do think that there will be an increasing focus on social responsibility and on innovation, the things that we've been discussing, Sean. So I feel that Australian Unity in particular is in the right segments and with the right levels of energy to participate in that. I should round out my comments by saying that it pays to take a long-term view when it comes to investment and to back innovation. That's something that I firmly believe in. For me in particular, as the Chief Investment Officer at Australian Unity Wealth, that's about ensuring that we offer quality, differentiation and relevance to our members and customers across our entire product range, both today, Sean, as well as in the future.
Joe, thanks for talking to Fear and Greed.
It's a great pleasure.
That was Dr Joe Fernandes, Chief Investment Officer at Australian Unity Wealth. This is the Fear and Greed Daily Interview. Join me every morning for the full Fear and Greed podcast with all the business news you need to know. I'm Sean Aylmer. Enjoy your day.